Okay, so hi guys, this is Gemma from ASD Rocks with Richard Eisenmeyer from the ASD Clinic. And Richard has his PhD in a very specific area, actually, in mind abilities. Is that correct?
Theory of mind.
Theory of mind within the autism spectrum. Correct. And he's been working within the autism world here, I think, for 20 odd years for the ASD clinic.
We've been here about 12 years, but I've worked at various other places for over 20 years. Yeah.
And working within the autism world for
a long time.
Longer than that.
Yes.
If I can talk to you guys and teach you correctly,
correct,
I will never have to see
100% correct. That's what we try to do.
And that is what this is about.
Okay. Yeah, okay. Well, I'm more than happy to talk about.
Yeah,
you know, we do that a bit different to other clinics. There was a paediatrician in Melbourne that, basically if you weren't rocking and flapping, but you were a bit autistic, you'd come out with PDD and OS. And so, and when I'd see that, I just knew that if they'd been on that side of town, they'd gone through the paediatrician.
Is that where masking comes into the...
Yeah, so that's the problem about doing assessment. That's why we like doing the IQ testing, because, you've got to understand, somebody's clinic office it can be Aspie heaven, because it's essentially the psychologist or the paediatrician and the person. So that's one person, maybe a parent in the background. It's not a schoolyard or even a family dinner table. So these kids, a lot of our kids have got fantastic eye contact and smile and answer questions well. And the doctor says, well, how can you be autistic? You relate so well. Well, it's a fairly artificial environment. So, that's why I prefer doing the IQ testing to look for that sort of peak and trough pattern, because it's more objective. It's not based on my gut feel opinion of how would I know, whether somebody's on the spectrum. There's obviously, we've got our characters that are what we call waiting room diagnoses. You can just tell. But, when you talk about this new term masking,
you diagnosed someone on the way here, didn't you?
Right, yeah.
From crossing the road.
Yeah, why not? Yeah. So that's fine. And before this term masking, we used to call our girls, we say you've got actress syndrome, because they were fantastic actresses. And they wouldn't get diagnosed at 8. They might have seen a psychologist or a paediatrician, but they'd get diagnosed at 14, no problem, because all of that masking caused a lot of anxiety and then a big depression. And then somebody goes, maybe she's on the spectrum, and that's when they come. Why weren't you picked up earlier? And the parent will say, well, she used to love going to the doctors and answering the questions, but now she can't go to school because she's so exhausted and depressed. So it's tricky,
How early can you do an IQ test, and how verbal? That's the other thing.
I don't really try. You can. I think the WIPSI starts at about 2.5. I'd never trust an early IQ test. I would never trust the result, but I still might use it because it's a structured activity to do with a stranger. I'm a stranger to the kid, they're a stranger to me. But you need social communication skills. You need to focus. You need to, want to please the assessor and try your hardest. And if you're testing a 4-year-old who's a bit like a 2.5-year-old, I wouldn't trust that. So I've seen, kids get scores of 65, enter special school, because they've got supposedly an intellectual disability, and at 9 years of age they've got a score of 110. Their IQ hasn't improved. It's not been early intervention. It's just been they've been able to do the test. So I trust the scores a lot more at around 10, because if my clients are around 10, they're a bit like an 8-year-old. Most 8-year-olds can sit, focus, listen, try their best. You can reward them with something sometimes, and the result should then be fairly consistent through their life.
That was something really helpful that you gave me when we were seeing you but not go, was that concept or that idea that if you're 6 or 7 and acting 5 or 6, it's not a big deal. But if you're 12 and acting 10, it's a massive difference. But then when you're 40 and acting, right? So that actually helped me as a parent sort of get my head around the concept.
Yeah, I've diagnosed two people on Wednesday, and they had massive separation anxiety coming out of kinder into prep, and they were 5.5. But in some ways they were, you pluck me out of 3-year-old kinder and put me into prep, I reckon I'd be having panic attacks and not wanting to leave mum as well. So, and year 7. So you read any book on autism, there will always be stuff about transition, right? So going from kinder to prep, grade 6 to year 7, year 12 to TAFE and uni to work, because that's sometimes where you'll really, if you pluck me out of grade 5 and put me into my year 7 class, I would have put my pants as well. So, that's to me, if IQ is reasonable, I'll just automatically knock off about 2 years off the child's chronological age to sort of get a feel of, where they are social, emotional, organisation skills, listening skills. But if their IQ is lower, I will knock off other years. So, if they've got 80 IQ points, that might be more like a grade 3, grade 4 kid going into year 7. So that's a huge jump for,
I remember when I saw you first that time and I was pregnant, and you said to me, "Get ready to raise twins."
Yes, there's a bit of a delay. That's right.
And I didn't get it, and then I got it when I was raising twins, and then there was that really critical moment when Finn overtook his brother.
Early intervention in the 70s, if you were flapping and rocking, there were, early intervention centres that used to squirt water. It had water bottles and squirt water.
Like a dog.
At kids flapping their hands. There was one place that they used to strap them down. If they went on a community
here
walk,
in Australia,
they would be strapped down with elastic bands so they wouldn't flap going to the...
Bo was doing that at the gym the other night, wasn't
the bakery, so, because they were being taught, that, we did horrible things. I mean, there were speech pathologists that would grab these kids by the chin and say, you must look at me. And now I've got all these, 18-year-olds that have got this piercing, staring, sort of psychotic eye contact. And I go, okay, we're going to have to detrain that because trams and buses aren't going to be good for you. You're going to be like scaring people. So we detrain, we sort of teach the variability of eye contact because they're not really looking at you, they're looking through you, but it's kind of scary on the tram. So these are things that were done years ago when we didn't. And now when I speak to an adult or a teenager and ask about eye contact, and I go, well, how do you can do it clearly, and I go, well, yeah, I've taught myself to do it, but it's still really hard, and I'd much prefer to look away. But I know at school or in work I've got to do it because it's a bit more manual. And I've got other people who can do eye contact absolutely fine. By the way, I don't have to think about it. But a lot of my clients. I've got a pharmacist that I see, and I said, "My God, your eye contact's fantastic." And she said, "Yeah, it was pretty poor up until about 16, and I wanted a boyfriend. I realised boys like eye contact, so I started using eye contact, and I've been able to do it ever since then." So she taught herself to do it. Wow. Up until then, she just was very shy and timid and looked down a lot. And she's a perfect actress now. You would never in a million years think she's on the spectrum.
Really?